Hello viewers, today in this video we are going to discuss about necrosis and its types. Now let's see about the introduction. Necrosis has been classically defined as unprogrammed cell death that occurs in response to severe chemical or physical insult. External forces that may lead to this accidental cell death include extreme physical temperature, pressure, chemical stress or osmotic shock. Rupture of the cell, which is characteristics of necrosis, leads to leakage of the cellular contents onto the extracellular space. It is a form of cell injury which results in the premature death of cells in living tissue by autolysis. It cannot be reversed when large areas of tissue die due to a lack of blood supply. The condition is called gangrene. Symptoms of necrosis including pain, redness of the skin, swelling, blisters, fluid collection, skin discoloration, sensation and numbness. The general cause of necrosis including ischemia, which is the most common due to loss of blood supply as seen in myocardial and kidney infarctions. Physical agents such as trauma, burns, radiation and extreme temperatures can also damage cells. Chemical agents and toxins including acids, alkali, heavy metals and drugs contribute to cell death, while infections by bacteria, viruses, fungi or parasites can cause necrosis through toxins and enzymes. Immune reactions like autoimmune disorders and hypersensitivity responses can injure tissues, and enzymatic destruction such as pancreatic enzymes digesting fat in fat necrosis further leads to cell death. Additionally, mechanical injuries including cutting, crushing and rubbing directly damage tissues, collectively contributing to various forms of necrosis. Necrotic tissues appears as pale, dull, structureless, often firm or soft with clear demarcation from healthy tissue and may show discoloration like yellow, grey or black, it depending upon the types of necrosis. Now we'll move on to mechanism of necrosis. The general mechanism of necrosis begins when a cell is exposed to severe injury such as ischemia, toxins, infection or trauma. These stresses lead to ATP depletion which disrupts ion pumps and causes cell swelling due to the influx of water and sodium. Rising intracellular calcium activates destructive enzymes including proteases, lipases and endonucleases which damage cell membranes, proteins and DNA. As a result, plasma and organelle membrane lose integrity, allowing lysosomal enzymes to escape and digest the cell called autolysis. Ultimately, the cell ruptures, releasing its content into extracellular space, which triggers inflammation and results in irreversible cell death and tissue necrosis. Now we'll see about the types of necrosis. The type of necrosis are classified based on their causes and appearance. The most common is coagulative necrosis, typically caused by ischemia in solid organs, except the brain, where the tissue remains firm and the architecture is preserved. Liquefative necrosis occurs in brain infarcts and bacterial abscesses, where tissue becomes soft and liquid due to enzymatic digestion. Caseous necrosis seen in tuberculosis as a soft cheese-like appearance due to mix of coagulative and liquefative changes. Fat necrosis results from pancreatic enzyme action or trauma to fat, producing chalky white deposits due to fat saponification. Fibrinoid necrosis affect blood vessels where immune complexes and plasma proteins deposit in the vessel walls, giving a pink fibrin-like appearance microscopically. Gangrenous necrosis is a clinical term used for large areas of tissue death presenting as dry gangrene or wet gangrene with superimposed infection causing liquefaction. Coagulative necrosis is the most common type and usually results from ischemia in solid organs such as heart, kidney and spleen, but not the brain. Protein denaturation occurs, inactivating enzymes and preventing the rapid digestion of dead cells. Because of this, the overall tissue structure remains intact for several days even though the cells are dead. Microscopically, cells appear as faint ghosts with no nuclei and the cytoplasm is pink and glassy. Grossly, the tissue looks pale, firm and dry. Examples: myocardial infarction, renal and splenic infarction. Next, liquefactive necrosis. It occurs when enzymes rapidly digest dead tissue, turning it into a liquid viscous mass. It is common in brain infarctions because brain tissue is rich in lipids and enzymes and lacks substantial connective tissue. It also occurs in bacterial and fungal infections where neutrophil release hydrolytic enzymes producing pus. Grossly, the affected area appears as soft, fluid-filled and often forms cavities or abscesses. Example: brain stroke, abscesses in the lung or liver. Curious necrosis is a hallmark of tuberculosis and some fungal infections. It combines features of coagulative and liquefactive necrosis. The dead tissue appears as soft, crumbly, cheese-like material. Microscopically, it shows amorphous granular debris surrounded by granulomatous inflammation. Examples: TB lesions in the lungs, caseating granulomas and fungal infections, etc. Then, fat necrosis results from the destruction of fat tissue by pancreatic lipase or direct trauma. In acute pancreatitis, enzymes break down triglycerides into free fatty acids which bind to calcium to form chalky white deposits called fat saponification. Trauma can also injure fat, especially in areas like the breast. Grossly, the tissue appears opaque, chalky and irregular. Examples: pancreatic fat necrosis in acute pancreatitis, traumatic breast fat necrosis. Fibrinoid necrosis is seen primarily in blood vessels caused by immune complex deposition or severe hypertension damaging the vessel wall. It is characterized by a bright pink fibrin-like material within vessel walls on microscopic examination. Gross changes are minimal or absent, so diagnosis rely on histology. Example: polyarteritis nodosa, malignant hypertension. Gangrenous necrosis is a clinical term describing extensive tissue death, often in limbs or intestines, due to severe ischemia. There are two forms: dry gangrene and wet gangrene. Dry gangrene or coagulative necrosis, where the tissue is black, dry and shriveled with a clear line separating dead from viable tissue. Wet gangrene is superimposed bacterial infection, leads to liquefactive changes making the tissue swollen, moist, foul smelling and soft. Examples: diabetic foot gangrene, gangrene of the intestines due to atrial blockage. Now we'll see prevention and diagnosis of necrosis. Necrosis can be prevented by early detection and treatment of ischemia, controlling risk factors like diabetes and hypertension, avoiding exposure to toxins and infections, and ensuring proper wound care to reduce the risk of gangrene. Diagnosis is based on clinical signs such as discoloration, swelling, and pain, supported by imaging, CT, MRI, ultrasound, etc. And laboratory test includes enzyme levels and histopathological examination to identify the type and extent of tissue death. Treatment of necrosis depends on its cause and extent. Initial management focuses on restoring blood flow in ischemic areas, example with medications, angioplasty or surgery, and treating infections with antibiotics. Dead tissue is removed through debridement or surgery to prevent the spread of infection and promote healing. In severe cases like gangrene, amputation may be required. Supportive care including pain management, wound care and treatment of underlying conditions such as diabetes or vascular disease is essential for recovery. Thank you for watching and listening the video.